There are more African Americans with coronavirus disease.
14 million people in China are watching this live streaming show.
Who's going to let us disembark?
What is she doing here?
Hey everyone, I'm Jennifer in New York.
And I'm Kurumi in Tokyo.
It's May 8th, 2020.
And here's Quick Takes wrap of the pandemic this week.
Philadelphia was one of the many cities that saw COVID-19 disproportionately affecting the Black community. That data led a group of medical professionals straight into the underserved areas to help.
I'm seeing everything. Whole families of people where mom, grandmom, kids, everyone's positive. Police officers coming, needing to get tested that can't get tests at work. There's a huge need for us here. We are at one of the harder hit zip codes in Philadelphia where there are more African Americans with coronavirus disease and death. Think about how to use your skills and your talent to impact a community. And that's what we did. Once we decided we were gonna do it, it took 48 hours to get out in the street and test people. All right, good morning. I'm the surgeon and director. I want them all to watch my technique, so who wants to go first? It was reported that more African Americans were dying than other groups in the city. But the tests are not in our community and they're not easily accessible. There were so many barriers, and in seeing that, there was no way to really reduce the incidence of disease and death without testing people. And once I saw the city was not doing that broadly, that's how this consortium came to be. So then I just started going down the list. Okay, I have some testing kits in my office. My colleagues have testing kits. So I drove around the neighborhood and picked them up. And then we had a Zoom call with 30 healthcare professionals just to say who's available, who's comfortable testing, who's not comfortable testing. I reached back out to the city and I said, I need the zip codes where the majority of people are being diagnosed and dying. And then I reached out to my pastor and said, could you identify a church in each one of these zip codes where we could use the parking lot? We went from doing 10 to 20 tests a day to 350, almost 400. Today, we'll probably do 250 to 300, but that's only because we don't have any more testing kits. Come on, we're gonna do it together.
Okay, deep breath, deep breath, deep breath, deep breath, deep breath. Oh,
That's it, you're done, you're done. After folks are tested, they can be treated, they can be isolated, they can reach out to all the people they've been in contact with and quarantine. We don't want this to just be a Band-Aid. We want to help them establish care with some providers that will care about and be empathetic to their cause. The whole health disparity, a portion of it is who is providing your care. Is it someone who is empathetic to you? It is someone who knows your struggle. And oftentimes it is people of color, doctors of color, taking care of people of color. The only limiting factor we have is supplies, and it's great that the students are volunteering, but eventually they're gonna have to get back to their work. So financial support from the city, from the state, from the federal government would go a long way, but I don't have any of that now. There needs to be an office whose responsibility is not just when there's a crisis, but every day to handle something like this.
This is a captain from the bridge. 41 people have been tested positive for coronavirus.
It's never going to happen to me. It couldn't happen to me.
You just feel desperate when you're at sea. Who's going to let us disembark?
Hundreds of passengers on these ships have been infected, and Bloomberg Businessweek has been reporting in depth on what went wrong and what's next for Carnival navigating this very challenging crisis.
All right, Drew, so today we wanted to talk to you about the global race to find a coronavirus vaccine. We know that there's over 100 vaccines being tested, but can you tell us some of the leading projects right now?
There are over 100 different vaccine projects that are in some phase of exploration. And that can mean anything from having a possible method to develop a vaccine all the way up through human trials. There's only a handful of these vaccines that actually are in human trials right now. Right now, everything's at a very early stage. When you do vaccine development, you're giving it to healthy people. And so your tolerance for what is going to be safe versus what is going to be effectiveness really tilts towards the safe side. Some of the goals right now are seeing how much of that you can compress. Can you compress some of the human testing instead of having each company run its own set of trials? Would you try to create one giant master trial with a single placebo group and see how each vaccine does against that? The entire effort right now is to try and see where can you try to do steps at the same time while still trying to produce the quality of evidence that you need to know if it is safe and effective.
And doesn't that present its own concerns though, like expediting this whole process that typically takes months into what you're saying is a few months?
Typically, 5 years would be a really, really fast timeline for developing a vaccine. The Ebola vaccine that we have, they started work on that in 2014, and we only got that at the very end of last year. And when you push anything in the drug or vaccine world, of course there are risks. There are financial risks that you're going to do something and spend a whole bunch of money on it and it's not going to work and it's going to be a big waste. There are safety risks where if you haven't studied the vaccine effectively and you don't know how it acts. And there are scientific risks. This stuff is really hard to do and it's no guarantee whatsoever that it'll work in the end. I think there's a tremendous amount of risk in these accelerated strategies, just as there's always a tremendous amount of risk in drug development and vaccine development in general.
Do they know whether this particular coronavirus strain mutates? If and when we do get a vaccine, if people will need to take regular vaccinations?
All viruses mutate. The question is, does the mutation actually matter? Does it change how the virus behaves? Does it change how it infects people? Does it change how sick people get when they are infected? Does it affect a part of the virus that a vaccine is targeting? Those are big questions, but I think they're ones that haven't been answered, and we don't really see a lot of evidence yet in one direction or another what the effect of any mutation is going to be.
What's the likelihood that a vaccine won't be developed, and what sort of challenges would that present?
I think that's a situation that we have to prepare for. We have, as a society, a pretty good track record in terms of developing vaccines, but we don't have a great track record of developing vaccines on the timeline that we're trying to with this pandemic. I think we have to be prepared for a world in which we don't necessarily have a vaccine. At the same time, we may have effective drugs against this that do reduce the risk for people who do get sick. A vaccine is an extremely important answer, but it's not the only answer to this medical problem.
Why is a vaccine so important to develop right now, and eventually for people to take?
Well, a vaccine is what creates the type of immunity that you want to have in a way that helps either wipe a disease out or push it out of the human population. When you have broad spread immunity, you don't have to worry about things like needing a drug. The vaccine, if it's effective, can create a level of group immunity that can be the most powerful weapon that we have against an infection like this.
She's a cross between Martha Stewart and Kim Kardashian. We talked to China's live streaming queen about how she's helping struggling businesses out in her own way.
For those who don't know Wei, she's a cross between Martha Stewart and Kim Kardashian. We're here today at the front of the Dongfeng Oil Factory, where Wei will host an hours-long fundraiser for Wuhan struggling businesses.
5, 4, 3, 2, 1.
Back on April 1st, she actually sold a rocket for 40 million yuan, which is roughly about $6 million. 14 million people in China are watching this live streaming show. I've seen her sell and taste everything from duck neck to crayfish. Life is slowly returning back to normal in Wuhan. Right across the street from the Huanan Seafood Market, we were told by the police not to take any photos in front of the market. And we heard today that a lot of the sellers will be moving to the outskirts of Wuhan, never to ever return. I'm here in front of this beef barbecue restaurant, a very popular restaurant. And as you can see, there's a for rent sign here.
今年的疫情来得特别的突然，就在想我能干嘛？我能帮助点什么东西？
She appeared to raise 226 million RMB.
因为疫情受影响的一些企业，包括一些品牌，能够很好的复工复产，想通过电商直播的这个力量来帮助他们。
的话，店铺卖79块9，然后我们直播间听一下啊，第一份。
South Africa has had one of the strictest lockdowns in the world. The government said a ban on the sale of alcohol and tobacco would expire once the lockdown ended, but now seems to have gone back on some of those promises.
This is 7th Avenue in Melville, Johannesburg, usually one of the city's most popular places to come socialize, dance, drink, and smoke. But for well over a month, not a single beer or packet of cigarettes has been sold here, legally anyway.
Legal beer was back. A long time between drinks.
The prohibition on alcohol and cigarettes here is part of a raft of restrictions on consumers aimed at curbing the spread of coronavirus. The South African government, in justifying its decision, framed drinking as an impediment to social distancing and also pointed to its links to risky behavior, domestic abuse, accidents, and violent crime.
He's a drunken driving a race.
With a high incidence of various diseases nationwide, it raised the alarm that millions could be more susceptible to catching the disease if drinking and smoking continue unabated. But above all, government said it needs to free hospital beds, and trauma related to alcohol is known to fill up emergency rooms.
We've certainly shown through our modelling that we're probably saving just under 5,000 trauma beds per week through the banning of liquor sales in South Africa. How many people per day can we fairly confidently say we're saving because of the lockdown measures on alcohol? It's about 15 deaths per day. But if you multiply that by the number of days of the lockdown, over 35 days, the mid-level figure would be 515 lives saved, which is substantially, probably double what we're seeing in terms of lives lost so far from COVID-19.
But this is little consolation to people who rely on alcohol and tobacco sales to earn a living.
That's a really problem for those on which are surviving through the alcohol, through selling alcohol. It's a pity for them, but at the same time, alcohol, you know, that is a problem in our country.
People are drinking a lot, so if you guys are opening the alcohol bags, a lot of families will struggle for food and stuff like that.
Thank you for all that you've done.
Other critics, meanwhile, say government has overstepped with punitive rules that impede individual freedom of choice.
People might think I support prohibition. I've been called a prohibitionist on Twitter, but I'm not. I consume alcohol and I don't like people telling me what to do. But many people are living in very crowded, difficult circumstances, and the government can't have different policies for different socioeconomic groups. We have to look at the way drinking occurs. More wealthy people drink generally than poorer, but their burden is higher amongst the poorer sectors of society. When you're limiting people's liberties, I think governments do better when they take the population with them. I think it's very important to share scientific information. We need to do more of that with alcohol particularly, and also with tobacco. We haven't done that, managed that PR process well. Certainly, I think we all thought that the cigarette ban was going to be lifted, and we really just had the population told to go cold turkey without much support. And I think a caring government, it would be good to see showing some empathy for people who are struggling with this, rather than having the image being a law enforcement image. If we catch you, we're going to lock you up, and we don't need it.
The legal sale of cigarettes and limited sale of alcohol is only expected when a more relaxed phase of lockdown is implemented, and when that happens is still anyone's guess.
Trolls may be breaking into your online group chats, so here are some of our tips to protect you against Zoom bombing.
What is she doing here?
What am I doing here indeed? Ah, the Zoom meeting, the now ubiquitous online platform that many of us are using for everything from work calls to distance learning to virtual happy hours. But with that has also brought the so-called Zoom bombing. That's when uninvited guests pop into our meetings, often with less than pure or even hateful messages. In response, the nation's largest school system, the New York City Department of Education, banned Zoom from online classrooms, citing security and privacy concerns. Several states' attorneys general have begun looking into the platform, and the FBI has even issued warnings. Zoom CEO recently addressed the security issues, saying,
"Our commitment to security practices and privacy practices in this process, and we are committing to this in the future as well."
But there are some simple actions you can take now to help protect yourself against would-be Zoom bombers. First, don't share your meeting link on social media, even if that seems like an easy way to get everyone together. That makes it public and anyone can join with that information. Second, and this may seem obvious, but use a password and lock your meeting once everyone's there. Also consider random meeting identifiers instead of your personal meeting ID when hosting. And finally, if anyone you don't want there does get in, you can always kick them out.
Hi everyone, I'm Sarah Pontic and I am a markets reporter with Bloomberg News. By this point in time, it is abundantly clear that the labor market has been hit hard and fast as the coronavirus forced entire economies to shutter. From cities to states to entire countries, jobs were lost. Here's one statistic to really consider. In the decade-long economic expansion that began in 2009 after the financial crisis, just about 21.5 million jobs were created in the United States. Well, in the 6 weeks ended at the end of April, about 30 million people filed for unemployment insurance, effectively meaning that over a decade's worth of job gains were wiped out. Now, of course, the hope is that these losses will be temporary. These horrifying numbers will be temporary. And as economies start to reopen, businesses will hire workers back. Now, as some states are starting to come back online, they are opening slowly through phases, we will get a sense of this. How quickly are these businesses actually bringing employees and workers back online? However, the impact across states, across industries, has not been equal. For example, when it comes to states, those with the highest insured unemployment rate, they're the likes of Vermont, Michigan, Connecticut, and Pennsylvania. That as of the end of April. At the same time, when it comes to industries, you can imagine those in the travel and leisure space have been hit hardest. Hotels, restaurants, airlines, we've heard this time and again, but we continue to hear from more individual companies about what their actual plans are. For example, this past week alone, we heard from the likes of Airbnb. They said that they are letting go of a quarter of their staff. United Airlines said that they're gonna let go of 30% of their managerial and administrative staff when government restrictions lift a little bit later on this year. We also learned that Wyndham Hotels had laid staff off at the same time. NBC Universal is also weighing layoffs. However, there is a bright side, and you can say some companies at least are hiring workers to keep up with demand. For example, Amazon has hired about 175,000 workers. Walmart has hired 150,000 workers, and they also announced plans to hire 50,000 more. Companies like CVS, also Kroger and Papa John's, they have also been hiring, and Shake Shack just recently announced that they are bringing on some workers that were previously furloughed. So as we do see states start to come back online, we'll see if others follow suit.
This is a captain from the bridge. 41 people have been tested positive for coronavirus.
It's never going to happen to me. It couldn't happen to me. That's what me and my friends were saying on the ship.
All guests, please stay inside your staterooms and do not go outside of your staterooms.
You just feel desperate when you're at sea. Who's going to let us disembark?
I don't think that they were terribly transparent about what they knew when they knew it.
Carnival is, of course, the biggest cruise ship company in the world, and since this began, their ships, more than any other companies, have been struck by these outbreaks of COVID on board.
Hundreds of passengers on these ships have been infected, and some have even died. And Bloomberg Businessweek has been reporting in depth on what went wrong and what's next for Carnival navigating this very challenging crisis. On February 3rd, the Diamond Princess was around the coast of Japan. It had made stops in Hong Kong, it had gone to Taiwan and elsewhere.
It was supposed to be our last night on the cruise. We were supposed to get off the next morning. Around 6:30 that night, an announcement comes throughout the entire ship.
A Hong Kong resident who traveled for 5 days on Diamond Princess from Yokohama to Hong Kong tested positive for coronavirus.
Here it goes.
As you can see, ladies and gentlemen, the situation is under control and therefore there are no reasons for concerns.
That's really when we knew that we probably were not getting off the ship that next morning.
So the ship cruises toward Japan and finally anchors in the evening of February 3rd. At that point, Carnival says that Japanese health officials came aboard and started doing temperature checks, health screenings. Unfortunately, according to passengers, this wasn't a really serious quarantine. Passengers said that they were free to go about the ship.
My cabin mate and the other two guys that we were traveling with, who were in the cabin next door, they went out and they had a grand old time that day, you know, as most people did. Eating in the restaurants, watching the live house bands.
Eventually they find out that there is actually cause for concern.
The Ministry of Health has notified us that 10 people have tested positive for coronavirus. All guests return to their cabin and remain there for the time being.
We have confirmed 10 positive cases, and based on this, we are going to quarantine the entire ship for a minimum of 14 days. So that's when it officially began. We are currently in the middle of day 2 of a 14-day-long quarantine. It is currently day 3. Apparently 41 new cases on the ship. There are 38 new people who have tested positive, 44 new cases.
66 additional positive cases of coronavirus.
We continued to see the numbers go up every single day. It was an emotional roller coaster.
In the end, more than 700 people were infected, and tragically, at least 11 people ended up dying. And this was just the beginning of the crisis for this company.
I want to highlight one of the most impressive turnaround stories of our era, if not the most impressive turnaround. I'm talking about Carnival, CCL, the world's largest cruise line. Are you bigger than the U.S. Navy?
You know, that's a good question. I never compared numbers of ships, but I doubt it.
The cruise industry is really massive. Carnival Cruise, they say they see about 13 million people annually. This is a booming market. People love to cruise.
We've probably done 24 cruises. Sometimes we've done 2 or 3 in a year if we're lucky.
Cruises are the perfect combination between being convenient, being affordable, and allowing you to just relax.
You pack once, you unpack once, your hotel moves with you, your restaurant moves with you.
Carnival specifically, they own about 30 to 50% of the market. Their annual revenue amounts to about $20 billion. More recently, Carnival has run into some troubles. You might have seen them in the news in the 2010s. They had a boat that capsized and actually sunk, killing about 30 people. And then later on, they had a very high-profile incident in which they lost power on the ship and none of the plumbing worked. But under Arnold Donald, who is the current CEO of Carnival, they've undergone a remarkable turnaround since about 2013.
The more we give people the opportunity to connect and experience the world together, the more spectacular our world will be.
You saw the market cap in the first 5 years under his tenure essentially double to about $50 billion. Ironically, leading into this whole crisis that we've seen, you had Arnold Donald promising that he was actually going to correct things. He had a plan in place to fix all these shortcuts that Carnival had historically been taking.
Our task, our mission, double-digit return on invested capital in the next 3 to 4 years.
Well, I want to congratulate you on the textbook turn. The whole trend has been up.
After the Diamond Princess ship, about a month passes, and then another ship, the Grand Princess, they deal with essentially the same crisis.
We boarded the ship in San Francisco, and
we did think there would be a little more enhanced screening because of what had happened on the Diamond Princess. At a minimum, we thought they would have at least taken our temperature as we boarded the ship, but that never happened. And things just kind of exploded on our way home.
The first tester in, and the coronavirus is on board the Grand Princess. The Coast Guard delivered tests in dramatic fashion, and 21 people tested positive for the virus.
it just kind of escalated quickly. They, sequestered us to our rooms and delivered food to us in our rooms, and obviously that was a major shock of something's wrong.
So like the Diamond Princess in Japan, which they sailed immediately back to port, the Grand Princess headed back to their home port of San Francisco.
3,500 people stuck on that cruise ship off the coast of California. They will finally be coming ashore.
All passengers and crew will be tested for the coronavirus. Those that need to be quarantined will be quarantined.
In the end, it proved a much smaller outbreak than the Diamond Princess, but that's most likely because not everyone chose to get tested. In the end, more than 130 people tested positive, and at least 5 passed away. As these issues are happening aboard the Grand Princess, another ship owned by a different Carnival cruise line, which is Holland America's Zaandam, is sailing around.
The cruise basically set sail more or less the same day that the U.S. State Department warned people not to be going on cruises. And the company just forged ahead with the cruise. For some reason, they decided to keep going.
Life was good that first week. Everything was great, but I saw a friend's picture about having issues getting toilet paper and other things. I was kind of concerned as to how this was going to play out.
March 14th, the ship received word that Chile was planning to close its ports to any cruise ship. And from then on out, that ship was at sea with nowhere to port. On March 22nd, the captain came on the announcement and said, "We have people sick with a flu-like illness. Everybody's got to be confined to their quarters. The whole ship's going into quarantine."
From March 22nd was kind of a different feel. It didn't feel like a cruise anymore. Sometimes I sat out on the deck at night and I would just listen to the waves. Now, sadly, sometimes I listened also to a cascade of people coughing.
After everybody was confined to quarters for a few days, the captain came on the announcement and said, "We're sorry to report that 4 people have passed away over the last couple of days." So many crew on the Zaandam were getting sick that they were having trouble taking care of all the passengers. And so the company made the decision to bring in another ship called the Rotterdam. They started ferrying passengers, 500, 600, 700 passengers who seemed to be less sick. They put them on the Rotterdam. And so now they had 2 ships full of passengers that could not come to port. Panama didn't even want them to go through the canal. Finally, the Panamanian government decided, after all, to let them go through the canal, and that's what happened. Both those ships passed through the canal, and they slowly made their way back to Florida.
After days at sea and with their fate up in the air, a pair of Holland America cruise ships were given clearance to dock at Port Everglades Thursday afternoon.
Yay, we're back home.
Back to the States.
There were quite a number of people that were actually sick, and they were taken to hospitals. And of course, there were those 4 people who had passed away that had to be taken home or find a way home.
We've gone through Ebola, Zika, MERS, SARS. The industry, because we're global, we have to deal with this stuff. You know, it's been devastating temporarily, but the long-term future will be great as long as we all stand together.
So since this crisis began, Carnival, its business has really been suffering. We've seen its stock really plummet quite significantly. We spent weeks talking to company executives, and the company was really upbeat and positive, if not defiant. The CEO, Arnold Donald, kept saying, look, back when this first affected our first ship, the world still hadn't known about coronavirus yet. It was still, in his words, it was still a China issue. We talked to the CDC, we talked to the head of their cruise ship task force, Dr. Cindy Friedman, and she said that excuse does not fly. It would be one thing if it was only aboard the Diamond Princess or even the Grand Princess, those first two ships, but the fact that this crisis continued to affect Carnival afterward, essentially Carnival should have known better.
I look forward to cruising again one day, but you know, I realize the paradigm has changed. It's very easy to say, would you ever cruise again? But I'm wondering, well, what's the world going to look like? Will we ever be going to a concert, a sporting event? You know, it's not just cruising.
One thing that I do agree with Arnold Donald on, he said this is an unprecedented generational global event. And I think that's totally spot on. And in the years ahead, we're going to look back and we're going to see who responded to that generational crisis well and who did not.
You'll have made it through the time of great sacrifice and great need, and no one will be more fresh to the task of restarting our measure of normalcy than you chosen ones.
All right, that wraps things up for us this week. But remember, you can get all of your coronavirus news from Quick Take 24/7 on Twitter, Instagram, Facebook, and YouTube.
And for a daily recap of the day's top stories, subscribe to our newsletter. Thanks for watching. We'll see you next week.